Thank you very much for giving me the opportunity to speak to you today. Like Antonio said, this is going to be a double act, buy one, get one free. One that's good, actually, but worth it. So myself, I'll be speaking about diet policy. I sit in public health, so it's basically about sort of diet and health that I'll be talking about. And then Robin here is going to speak a bit more broadly about the sort of wider food policies that we have within the Scottish Government. I should say that I haven't had the opportunity to see the other presentations from this morning. I have obviously been here this afternoon, so I'll refer to a few things this afternoon. I have to say as well that Valerie is probably still in about half of the things I was going to talk about, so but thank you for that. I did that very well. So what I am going to talk about is, just in terms of an overview, Scottish Dietary Goals, which I believe you heard a bit about this morning as well. What the root causes are, what our policy landscape is in relation to diet policy, because it isn't just about health and well-being, who the key players are and what our current policies are, some examples in 10-15 minutes or so. You'll have probably seen something like this already this morning. This is a slide courtesy of the Food Standards Agency, which neatly summarises where we are in relation to the Scottish Dietary Goals. These dietary goals, well, the original dietary goals were set up in the mid-90s following the Scottish Diet Action Plan's publication, and then they were revised very recently. The reason being that the evidence, as has been illustrated very on the there, constantly changes, so we constantly need to kind of try and keep step with that. So here's where we are at the moment with the dietary goals. As you can see, progress is not fantastic. That doesn't mean to say that we've not achieved quite a lot of successes along the way, but obviously a lot of the problems and the barriers that we have to face are quite significant. The dietary goals also are looked at in relation to inequalities. And as you can see, that throws up a few other strange anomalies. So, for example, with saturated fat, we have the lowest consumption in the most deprived, whereas you would think that that might be the other way around. Again, there are certain reasons for that. So, people who are on the highest incomes might buy a lot of foods that are so high in saturated fat. Not necessarily fish and chips, but foie gras and other lovely expensive things that go and contribute towards saturated fat intake. So it's a complicated sort of situation. Well, talking about the root causes that we have here. I think it's been mentioned today already about the lack of knowledge and skills. So the inability to cook food, no awareness of food, and some of the programs we heard about that Bill and Liz spoke about earlier today try to sort of mitigate that. Poor shopping skills, basically people who don't know what's healthy and what's not healthy. And as you said earlier on, what is 120 calories in food? We can go on about that message about 120 calories. It is a dietary goal, but it's pointless actually stating you should be eating 120 calories of food less, because people wouldn't know what that means. Poverty and inequalities. Obviously, it's about a lack of money, but it's about a lack of time as well. It's about people who have chaotic lives for whom food is, never mind talking about eating healthier, it's talking about actually eating at all. And very struck by what Pete said earlier on about food being an inalienable right rather than something that we see as being a charitable handout sort of thing. I think there's a lot of discussion that policymakers and politicians need to have on that subject. So certainly welcome what he was saying on that. For me, this whole issue it's partly about food, but it's mainly about tackling poverty. So we could do all the various things that we do within healthy eating and diet and all these sorts of things. But unless we tackle poverty, we're not going to get around this problem. We have marketing and promotion, so picture here of the London Eye in Coca-Cola red, just in case you weren't sure. Kind of demonstrates that marketing and promotion is absolutely everywhere. Price is the biggest driver in terms of what is bought, so we could go on and on about healthier and advertise that products are healthy, but actually for a consumer that doesn't hit home. So we need to, if we want to get people to eat healthier food, we need to do it in a more subtle way, and we need to use price to our advantage. And again, as Valerie was mentioned earlier on, the shopping experience is an emotive one. It's not one based on logic. So that means that absolutely education is important, but we need to also talk about changing how foods are promoted within the store, so that people are, without knowing it, going to be steered towards healthier options. Age-of-assessed foods that are high in fat, salt and sugar are, again, one of the root causes. So we're talking here largely, I think one of the biggest problems we find are what we call discretionary foods. So these are foods that should be okay to eat as a treat, but actually what's happening is they're being consumed on a regular basis and in far too large quantities. And linked in with that are some limits that there would be to the reformulation of those foods. We're constantly trying to engage with the food industry to reduce the fat, salt and sugar, and there are certain limits to how far you can go with that. Eventually, it comes down to just eating less rather than actually making the product healthier. Entrenched behaviour is the last point I've got up there. Making changes is difficult. For consumers, it's very difficult because of that kind of unconscious behaviour that we have. You will go into a shop and you'll buy the things you've always bought. So changing that behaviour is really hard. What we look for are these teachable moments. So when significant changes happen in somebody's life, so if they have their first child, or if they're moving house, or whatever, that's when we try and sort of get into with these messages. And again, that ties in with some of the stuff that happens in local communities. So you'll have community groups that are based around, for example, the birth of the first child, so for maternal groups. Entrenched behaviour is not just about consumers there, it's also about the food industry, and it's also about government and politicians as well. There is a certain lack of a willingness to change. If you've, as a member of the food industry, if you are selling lots and lots of product, why should you change? So, a little bit about our policy landscape, and Robin will touch on this a bit more, but diet policy sits within a landscape that is much broader than that. And these are all sort of things that have come up previously. I've got sustainability up twice. I don't know why. It's so important, obviously. But these are all the things that health has to kind of compete with almost. And it becomes a real problem in trying to find its place. Let me give you a really easy example to get your head around. One of the things we had to do for our new campaign, which I'll talk about later on, was to create loads of recipes so people could go online, find recipes that were healthier for them, and develop those. Well, that's fine. That sounds nice and easy, but as a Scottish government, we have to think about how does that support Scottish produce. So there's a problem in Zandvoort. Is it sustainable? Are the kind of foods we're asking to buy to go into that recipe, is that sustainable? Education, is it easy to cook? Poverty, is it cheap? Would people be able to cook it with the limited tools at their disposal? Because a lot of people don't have ovens, so you'd have to think about what can be chucked into a microwave, what can be easily prepared. So all these different things come in, and that's just creating recipes for our campaign. So with policy making, it's all of these things as well. So that makes our job quite challenging. On top of that, we have at the bottom the EU and the UK government. which sometimes can be helpful and sometimes not so. So the UK government, for example, can be helpful in terms of their responsibility deal. So a lot of stuff that's been pushed forward on a UK basis is stuff that we would want to push forward anyway. However, some of the benefits changes that have been made by the UK government recently are probably less than helpful because they cause a lot of the poverty issues that we see around today. Certainly that's what our minister would be saying anyway. So again, that's the kind of environment that we have to work in creating policy. Now, key players. So we've got the food industry, obviously. Our public sector, we've got a very big public sector, and we need to use that in order to showcase the policies that we have. So the health service, local authorities, the Scottish Government, we need to be showing lead. There's schools, and it was briefly mentioned earlier on about school meals. And obviously this government has extended the free school meals provision most recently. There's communities. So a lot of stuff the bill has spoken about, and we've funded Community Food and Health Scotland for 19 years now, and hopefully we'll continue to do so. That helps to basically build capacity within the community food network. So it's not about the Scottish Government actually funding a community food initiative here or there, it's about actually the wider network. There's also consumers as well as being key players. So in terms of our actual policy documents, here's where we kind of sit. I mean, there are more documents than these, but these are the main ones in relation to health. Our national performance framework are basically a number of key goals for the Scottish Government, and the one that this sits in with is basically about us living longer, healthier lives. The three sort of key health policies we have are the route map for preventing overweight and obesity, Beyond the School Gate, which is about trying to improve health and well-being, or trying to improve the provision of healthier produce just outside the school gate. And it's a sort of toolkit for local authorities and other key players around the school gate. And then supporting healthy choices, which is all about our engagement with the food industry. And it's got 17 different commitments in there. So 4 core principles that we have about putting the health of children first, and that's asking the food industry to make certain commitments around removing confectionery from tills. We're currently working on children's menu guidance because none exists at the moment in Scotland, so we're working on that. And also asking the food industry to incentivise healthier meal deals. It's about rebalancing promotional activities. So again, we're asking the food industry to think about their in-store and their online promotions, about sort of catering outlets for them not to ask customers to go large in any kind of portions that they're asking for. It's about offering healthier components of standard meal deals. It's about adopting front-of-pack labelling, so some of the things, again, that Valerie has touched on. And it's about calorie labelling and joining the Eat Better, Feel Better campaign, which we launched earlier this month. And the final part there, about formulating healthier products and menus across retail. So that's about the actual technical side of product reformulation, better catering practice through our Healthy Living Award, and giving people at least a portion choice of a smaller portion. So how does this translate into policies? That seems to have got up quite a lot in one go. So just in December there, we launched Reformulation for Health, which is a culmination of a 2-year project that we ran with the assistance of the Scottish Food and Drink Federation, and it's guidance for small and medium-sized enterprises to reduce the amount of fat, salt and sugar in their products. And it might seem very kind of minor stuff, but actually a lot of these very small companies have a big impact on the food chain. So you'll find a supplier like Cardow Creameries, because they've made that 66% salt reduction in their pastry margarine, all the pastries that use them as a supplier will have a lower salt content. So it actually has quite a significant impact. Better eating, better learning. Again, this is like a complementary document that our education colleagues have put forward, through that and through the education programs that we have, we've supported lots of school projects and opportunities for pupils to learn a bit more about food, both inside and outside school. We have the Healthy Living Award, which is partly Stuart there. So we've got over 700 sites in Scotland who have got the Healthy Living Award, which is basically a set of criteria to provide healthier food options. And we've set, again, thinking back to the public sector, we've set the NHS with targets for meeting that in all their catering divisions across all hospitals in Scotland. By the end of March this year, they are required to have achieved that. We're working with the voluntary sector on a voluntary basis to do that as well by March. In the coming year, what we're going to do is we're going to extend that out to retail provision as well, so that when these contracts get renewed, they will have to do that on the basis of serving healthier products. Last thing is the front to back labelling. Again, as I say, Valerie has mentioned that. I realise this is not a silver bullet by any means, but I would actually support what we've done with front to back labelling. I think the research has shown that consumers do value this. It is a useful way for them to see at a glance what is high or low in fat, salt, and sugar. And the other benefit of this is that for some of the companies that have been using it for some time, it's actually encouraging them to reformulate. So, for example, Sainsbury's, who were one of the early adopters of this, have come back to us and said in their own brand, they've reformulated quite a lot of the products to kind of get the reds to become ambers. So that's a kind of fringe benefit of that. Our Eat Better Feel Better campaign was launched earlier this month, so there's a lot of activity along in stores, and again we're working with the food industry to try and affect that. So we're doing a lot of things. Not all of it is successful. Some of it has a very limited success because of the problems and difficulties that I've spoken about. There is some cause for optimism, and I'll finish off with a few slides that kind of hopefully shows that. I don't think that we as Scottish Government can claim credit for all of this by any means, but it's nice to be able to see that we are beginning to move in the right direction for certain things. So, for example, soft drink sales, if you look at regular soft drinks, that's on the decline and has been for a few years now. Obesity is still terrible, still high, but the figures do show, again, a slight decline since 2010, and that's a year-on-year decline. So it's not where we want to be, absolutely, but there are suggestions that we're turning the corner. Thank you very much.